Hello, I'm Dr. Beverly Vaughn, and welcome to our Menopause and You Chat with a Physician. Today we will be discussing the aging breast. I am pleased to introduce our guest, Dr. Emily Pollard, who is the Chief of Plastic Surgery at the Lankenau Medical Center. Welcome, Dr. Pollard.
Thank you, Dr. Vaughn, for having me today.
I wanted to ask you, what are the factors that are involved in the natural aging of the breast?
Well, first we have to look at the anatomy of the breast, and we can start at the basics. You have the ribs, top that with the pectoralis muscle. On top of that is an envelope of skin that encloses both breast tissue and fat. So as we age, if we look at all of that, we look at our bone density over time, which decreases, so sometimes the ribs can cave in. After age 30, our muscle mass decreases with each decade, so the pectoralis muscle then atrophies and becomes smaller. The skin envelope can be affected by smoking, excessive sun exposure, dehydration, and also weight changes, going up and down with your weight. And then you look at the breast tissue itself. Over time, going into menopause and beyond, your estrogen is decreased, so the breast tissue actually shrinks, and it is replaced by fat. So fat can contribute to the size of the breast, either by losing weight or gaining weight.
That's very interesting to me, because I think certainly myself, and I'm sure other women, don't think about all of those different components that contribute to breast health and breast appearance.
Yes, and then you add gravity to that, and you've got a great combination. So again, you start thinking about your posture. You want to strengthen your bones. You want to keep your muscles strong. And those three components will definitely help the appearance of your chest.
So there are certain things that individuals can do to help in their appearance. Are there other things that would be helpful, say a different kind of bra? Any other suggestions that you have that women can do themselves?
Oh yes, of course. Well, the first one would be to move to the moon, where there's 1/6 the gravity, and so we don't have to worry about that. But also avoiding smoking, excessive sun exposure, wearing a very good sports bra when you're exercising, and watching your weight, not too much of a fluctuation. Keeping yourself moisturized and hydrated also contributes to the health of your skin, which is the envelope that is holding your breast up.
I've certainly heard about exercising muscles in your chest to help with appearance. Is there any validity to that?
Some people do talk about either breast-enhancing creams or exercises. What that's going to do is just make either the skin appear more healthy, or it's going to make your posture and the foundation on which the breast rests better. But there are no actual muscles within the breast that can be strengthened or weakened.
As a plastic surgeon, what procedures can you offer to women?
There are a number of procedures that I can offer to a woman. During my consultation, though, I want to hear from them what concerns them about their breasts. Are they too long? Are they empty? Are they too full? Are they too wide? Because once I get that information, then I can formulate a plan to approach it. Either we need to tighten up the skin, or add more volume, or do both, or decrease the volume and tighten the breast. I look at the breast, when they start talking to me, as a sock with oatmeal in it. So if you look at it like that, you say, well, and I ask the patient, well, is the sock too long? Do you want the sock to be tightened? Are you pleased with the amount of breast tissue or oatmeal? And that helps me formulate the plan.
So addressing those concerns, what would you do if the breast was too long? What would you do if the woman felt her breast was too heavy or too small?
Well, let's start off with too heavy and too large. What I would perform is a breast reduction. I would reduce the size of the breast, lift up the nipple so it's in a higher position, because oftentimes it's looking down into their socks, and then tighten up the skin afterwards. And that's called a breast reduction. Some of these women also complain of back and shoulder problems, irritating rashes underneath their breasts, or the inability to exercise and participate because of back and shoulder pain.
And what about breasts being too small?
Well, if the breast is too small, there are a number of options available. One is the gel-filled silicone implant, which will increase the woman's cup size. So if she has an empty sock or empty breast because she's got thinner, she was breastfeeding, she's lost all that tissue, so now this breast implant will be placed in behind the breast tissue and giving her more volume. This is a silicone-filled gel implant, and then they also come as saline-filled implants, and this one isn't filled up, but it comes empty and is filled up during the surgery.
So you can adjust the size?
Yes, you can. And these come in literally hundreds of sizes. So we can fit the 4'11" woman, and we can fit the woman who's 5'10". Someone who has a smaller chest wall would certainly go with a smaller implant, and a taller, more broad-chested woman would go with a larger implant. So we have all kinds of sizes available.
And what about a breast being too long? What would you do for that individual?
Well, then we have to look at the skin, and that's what's giving her that long, droopy appearance. So it's not so much taking away breast tissue or putting in something, but actually tailoring and tightening the skin. So instead of the nipple being long and low on the chest wall, we bring it up and tighten up the skin around it.
Dr. Pollard, thank you so much for being with us today. It was wonderfully valuable information for our audience. Thanks for sharing.
It was a pleasure. Thank you very much.